Some healthcare providers are still reeling from federal funding cuts and now also bracing for state cuts that are expected next year. Sounds like a perfect storm, but one healthcare center tells NBC7's political reporter Joey Safchik they will continue to provide for patients no matter what.
The state budget leaves some unfinished business when it comes to funding for health care, decisions that have now been punted and will be left up to the next governor. The next governor of California will inherit some difficult decisions about health care coverage as the newly passed state budget delays some deep cuts until next year. That's set against the backdrop of federal funding cuts already hurting local health centers.
That a lot of folks are going to be seeking care without any coverage.
Anthony White is with TrueCare, a community clinic in San Diego. They've already started to feel the pain of the federal funding cuts. Over the past few years, he says, the number of people with MediCal coverage has increased, which also increases access to preventative care. But since January of this year, he says the clinic has tracked a steady decline of people with that coverage.
A lot of the restrictions and changes haven't even been put into place yet. So we know that once they do, it's even going to decrease the number of people that have health care coverage in our community, even worse.
The state budget does not give counties dollars to set up an indigent system, meaning free services for people who fall off MediCal. But County Supervisor Paloma Aguirre says the county has been trying to weave its own safety nets.
I think that nothing will ever offset the decisions in D.C., but we are sure as heck going to ensure that we do whatever we can for the people of San Diego County.
And the state budget does send dollars to counties to help them help people figure out when they're eligible for assistance and navigate the increase in paperwork.
We want to make sure at the county that we're offsetting those cuts by increasing staff support to ensure that nobody falls through the cracks or nobody falls off of these programs.
The next governor will have to decide whether to increase the monthly premium for undocumented adults enrolled in MediCal. This plan also delays cuts to dental benefits for undocumented people on MediCal and clinic reimbursements for MediCal services, all until next year.
We're concerned mostly about our patients. We're going to be here. We're going to be here to serve and care for them.
And look, when fewer people are insured, that means hospitals are making less money. So in this budget, there were a couple $100 million dedicated to public hospitals and hospitals facing financial duress. Joey Safchik, NBC7.
Also next year, the state is set to limit coverage for some asylees, refugees, and human trafficking survivors to just emergency and pregnancy care.